Welcome back to Health Bulletin. Here's your global health update with some of the most pressing stories we're following right now. Let's start in the Philippines, where Quezon City is grappling with a severe dengue outbreak. From January 1st to March 5th, the city has recorded 12 dengue-related deaths, a staggering 500% increase compared to last year. The latest fatality, a heartbreaking case involving an 8-year-old girl from Barangay Pasongtamo, highlight just how dangerous this outbreak has become. With cases now exceeding 2,300, health officials are urging everyone to seek help at the first sign of dengue symptoms. It's a stark reminder that our vigilance can truly save lives. Moving over to Nigeria, the situation with Lassa fever remains critical. In just the first 8 weeks of 2025, the CDC has confirmed 506 cases and reported 95 deaths, maintaining a case fatality rate of 18.8% from last year. Most of these cases are concentrated in 3 states this time: Ondo, Bauchi, and Edo, with the rest spread across 9 other states. Lassa fever, which is transmitted through contact with food or household items contaminated by infected rodents, is an ongoing challenge during the dry season. The numbers are a reminder that seasonal outbreaks demand constant attention and swift public health action. And we've got some fantastic news for you all. YouTube is soon rolling out a dubbing tool for Health Bulletin. As you know, we cover everything from disease outbreaks to science and space, and we offer subtitles in 32 to 35 different languages, reaching countries across the globe, even Trinidad and Tobago. So please support Health Bulletin and don't forget to check out our new dubbing feature. Now let's head over to the United States, where Texas is seeing a resurgence of measles. The South Plains region has reported nearly 200 cases since late January 2025, with 23 patients hospitalized and 1 tragic fatality, a school-aged child who wasn't vaccinated. Even though measles outbreaks are not new, this one has sparked a renewed urgency among health officials to emphasize the importance of immunization. And you know, in a recent cabinet meeting, U.S. Health Secretary Robert F. Kennedy Jr. reassured everyone that these outbreaks, while serious, are not unusual.
And there are about 20 people hospitalized, mainly for quarantine. We're watching it. We put out a post on it yesterday, and we're going to continue to follow it. Incidentally, there have been 4 measles outbreaks this year in this country. Last year, there were 16. So it's not unusual. We have measles outbreaks every year.
Still, the message is clear. Staying up to date with vaccinations is critical to preventing further spread. Finally, over in Uganda, a new cluster in the ongoing Ebola Sudan virus outbreak has emerged. The latest cases have been linked to the death of a 4-year-old boy, and now a second cluster has been identified, with both newly confirmed patients and currently undergoing treatment. This outbreak, marking Uganda's first encounter with Ebola Sudan virus strain since 2022, has prompted swift action, including a trial of a candidate Ebola vaccine and the administration of remdesivir for treatment. Ebola, as you know, is a highly fatal disease that spreads through direct contact, and every case is a stark reminder of how quickly these outbreaks can escalate. From the dengue crisis in Quezon City and the persistent threat of Lassa fever in Nigeria, to the measles outbreak in Texas and the Ebola cluster in Uganda, these stories highlight the urgent need for proactive public health measures around the globe. Each of these situations reminds us that our health is interconnected, and staying informed is the first step toward effective prevention and response. And please subscribe to Health Bulletin for all the latest updates on outbreaks, scientific breakthroughs, and everything that shapes our future.